Yes, you can start.
Okay. So cervical cancer is the most common cancer in women in Zimbabwe. We're actually finding that of all the cancers, 37% of the cancers in Black women are cervical cancer. And with that, we found that the COVID-19 pandemic has affected women quite a lot. A lot of them are not able to access screening. So screening for cervical cancer is for women who don't yet have symptoms. So things like VIAC, visual inspection with acetic acid, pap smears, which are supposed to be done every year for all women after the age of 21 years of age. And also women have had problems with diagnosis of cervical cancer. So these are women with symptoms of cervical cancer. So things to look out for, things like vaginal bleeding, vaginal discharge, pain in the lower abdomen or the back. So if you have any of these symptoms, to see your medical doctor. You have a test called a biopsy, where they take a small piece of tissue from the cervix and that gets tested. So we find with COVID-19, women were not able to actually travel to the hospitals because of travel restrictions. But what we have done is we give women special letters. So if you go to your nearby doctor, you can get a letter to help you travel to the central hospital to get your test done. Treatment has also been affected by the COVID pandemic, where patients have had to wait in long queues before they can get treated. So our machines have long waiting lists, but we're still helping, especially women with emergencies. So if you're having excessive bleeding, please just come through and we do treatment, which can be chemotherapy or radiotherapy. But if one has COVID-19, we do recommend that you have treatment for COVID-19 first, because our treatments can lower your immune system. So we treat the COVID-19 first before we treat the cancer. And also we're recommending vaccination to all people, even if you have cancer, especially if you have cancer, you need to get vaccinated, because if your immune system is low and you get COVID, then your risk of dying from COVID-19 becomes even more. So everybody should get vaccinated, even if you have cervical cancer or other cancers.
Thank you very much.